What are the criteria for involuntary commitment? Have you ever wondered what it takes for someone to be involuntarily committed? This process can be essential for families dealing with schizophrenia and other mental health issues. Let's break down the criteria that guide this legal procedure. First, the individual must be diagnosed with a recognized mental disorder. Schizophrenia is one such disorder, as defined in the Diagnostic and Statistical Manual of Mental Disorders. It is important to note that this does not include intellectual developmental disorders or substance use disorders. Next, there has to be a clear need for treatment. This means there should be a reasonable chance that hospitalization will improve the person's psychiatric symptoms or prevent them from getting worse. Another key point is the least restrictive alternative. This means that hospitalization should be the least restrictive option available to ensure the person's safety and well-being. If there are other options that could work, those should be considered first. The individual must also be unable or unwilling to consent to voluntary hospitalization. This is a critical factor because the goal is to provide care when someone cannot make that decision for themselves. Lastly, there must be a risk of harm. This can include the person being a danger to themselves or others. It may also involve being unable to meet basic needs, such as food, medical care, or shelter. Additionally, if the person is experiencing significant mental deterioration that affects their judgment or behavior, this can also be a reason for commitment. For families dealing with schizophrenia, understanding these criteria can be very helpful. Involuntary commitment can serve as a necessary tool to ensure that loved ones receive the treatment they need, even if they are not in a position to seek it on their own. The process can involve both emergency and judicial procedures. In urgent situations, immediate intervention may be required, while non-emergency cases might follow a more formal legal process. Navigating the legal and healthcare systems can be challenging, but knowing these criteria can help families advocate for their loved ones. It is essential to ensure that individuals receive the care they need while also respecting their rights.